Hi, I am Ahava. Today I'm joined by my friend Tony Gnau from T60 Health to talk about video in healthcare content marketing. You've got questions, we've got answers. Let's get to it. Question is about everyone's three favorite letters, ROI. It reads, Ahava, our executives and doctors don't see the value in video and keep pushing for more billboards. How do you measure ROI for video? How can I share the value of video with the powers that be?
First and foremost, if a leader doesn't see the value in video, it's because they really just haven't been presented what the value of video is. 92% of marketers report getting good ROI from video.
That's huge.
92%.
92%.
Chances are they are relying on marketing professionals to help guide them in terms of, what they need to do with their marketing and their budget.
I always try to take the tactic of, why don't you think this has value? Talk to me about what you're seeing. Like, watch how, people are consuming content and then tell me that like a billboard really is going to do that. One of the things I always say is, I don't, you practice evidence-based medicine, I practice evidence-based marketing.
One of the great things about video, just like any other digital asset, is you can literally show whether or not it's having an impact. You can look at the data and the analytics that you build into it that will tell you whether or not people are being moved to action.
It'll help searchers find what they are looking for online.
Well, I mean, first and foremost, Google loves video, so
Yes,
if you're
it does, and so does AI.
Yep. And so if you're producing video, you're getting a feather in your cap from the search engines for that, just for having it. But more to the point is, it's like I try to tell people, don't think of video as just being a singular video. We're producing a video. It should really be a part of your whole strategic marketing plan. And really, it's like if you think of your marketing funnel and, you've got the top, the middle, and the bottom of the funnel, you should be producing videos for each layer of that funnel as you're sending people down through it. And part of that is people searching for different topics and learning about you and becoming aware of you. And video is a great way, a great entry point for all of those people. I mean, like anytime you see a TikTok or a reel or a short, any of these vertical videos, everything, from a business standpoint, most of those are awareness videos at the top of the funnel. These are people who are looking for answers to different subjects, and they have found a vertical video that helps them. So, when it comes to like people searching for things, those vertical videos are great for this sort of thing. And the great thing is that they don't have to be high production value either. You don't have to spend a ton of money on reels. These are things that you can DIY if you want to, and you get the good search results then. So video is a great thing if you have a community of people that are searching for a subject matter around what you do.
Right. So I thought it was very interesting that you said, this answers a topic, top of the funnel. To me, those videos, though, also work for brand, because if you have a doctor talking about something, or you have a patient showing what a procedure looks like or what an experience looks like, I think it also impacts people's perception of, oh, you know what, I want to follow more videos from this brand, or I want to continue to watch more videos from this brand because they're giving me useful information. So I think they work both purposes. Do you know what I mean?
Sure, absolutely. Absolutely. Well, and I mean, video isn't a one-trick pony. I mean,
Right,
you
exactly.
can use it in so many different ways. And that's why it's like, I think a lot of times people will produce a video and it's almost like the video itself becomes a strategy. It's like we have something to promote. Let's do a
Oh, don't talk to
video.
me about that.
And it's like all of a sudden that video is the strategy. It's like, no. That's just a component of it.
Right.
Like
It's one part of
its
your
own strategy
ecosystem.
for success. It needs to be a part of the bigger plan. And the more you do that, the better you do that, the better those videos become, the more powerful they are, and the more likely it is that they're going to help you achieve your goals.
Yeah, absolutely. I mean, I think honestly, one of the things that we're talking about all the time now is that they're not starting at Google anymore. They're starting in social media. They're starting in GPTs. Like they're starting on YouTube, for example. They're not, just starting at like, tell me about why does my heart skip a beat? They really are looking for that information in other places, and they're trusting it differently depending on where they are. And that's why I think also too, video is so important because you can actually like tell a story at the same time that you're giving information, which in a written piece of content you can do, but video has the images there. So the exposition doesn't take as long. You really just immerse somebody in the experience right away. So I am often surprised when we get pushback on video, but I understand that, people are used to what they're used to doing, and they don't always, want to try new things, or their stakeholders are telling them, I want a billboard. Tell me a story about an organization or a project that exemplifies great video strategy.
One of the companies that we have been fortunate enough to work with over the years is Common Spirit Health. It's the nation's largest Catholic health system. When they merged with Dignity Health, Dignity actually already had a video team as part of the health system. So now anytime we're brought in, it's really just to supplement what they're doing. And they are doing amazing work. They are doing really, not only good quality videos, but I think the thing that impresses me the most is that there is a real strategy behind it. It's not, let's just do a video here, let's do a video there. We've got this new thing to promote, that new thing to promote. They have they sit down and they decide, what videos are we going to do this year, this quarter, this month? Let's, think about it strategically. And you can see that in what they're producing. Like if you go to their YouTube channel, they have, entire streams of just different series of videos that they have put together. And so there's a real plan behind it. And everything they do, you mentioned it earlier, they are telling stories.
Yeah.
They are telling success stories within their health system, whether that be patients, whether it be new procedures and techniques that they're doing, whether it be stuff that they're doing outside their system walls in their communities and how they're helping their communities as a whole. So they are telling stories in all these different areas, but all with a strategic mindset in terms of, how we're going to use this and why this is important. And they do it. They actually do it, which is amazing.
Yeah, I think so. To me, where video really takes off is like when it's a major part of the editorial calendar and it's really
Hmm.
thought through in terms of what are the messages that we're trying to get across and how do we keep repeating them, but in different ways. And that's what
Right.
stories do so beautifully. You can find stories that represent, we're a ministry that's really dedicated to people's health. And you can keep telling that same story over and over again through physicians, through doctors. Cleveland Clinic once did a video on a janitor. And I will never forget that video as long as I live. It was so beautifully produced. And it was like, you don't think about that person, but like that's a really important person in the running of a hospital. It was such a beautiful way to highlight and to show the brands, like thinking about the whole experience of what it's like for their employees, and then the whole experience of what it's like for patients. So I think that when you can sort of hit your messages over and over again in that way, that's strategy. That's what it is.
I do have to say that I think like many of the major health systems that we see across the country, they all get this. Like you mentioned Cleveland Clinic, like they get the power of video. They're doing this. You can go and they have robust YouTube channels. You can go to their websites and see the purpose behind how they're using it and where they're putting the videos and using it in email campaigns and all these different things. It's a part of their marketing system and what they're doing, and it's intentional and you can tell. So I mentioned Common Spirit, you mentioned Cleveland Health or Cleveland Clinic. You can go down the list. There are many health
Oh,
systems
sure.
that are doing a great job with this, and for me that's where it gets back to, if you have a stakeholder that doesn't quite know about video and they're giving you pushback on that, start looking at the competition, at whatever
That's a great
level that you
suggestion.
are at, and see what your competition is doing. Because if they are doing video and you are not, then you turn back to that stakeholder and you say, we are at a competitive disadvantage because they're doing this and we are not. And if they aren't doing video, it's not a matter of like, woo, thank goodness, now we don't have to do it. It should be, wow, now there's an opportunity.
Yeah,
Now
well,
we can actually get the competitive advantage if we start doing video because they're not. So, it's like it can work for you both ways.
totally. I think nothing gets stakeholders going more than competition, right? Tony, thank you so much for joining me. I'm really glad that you made the time to do this. Thank you to our viewers for joining in. I hope you got the answer you needed today. If you have a burning question, put it in the comments or email it to ahava.leaptag@ahamediagroup.com. See you next time.